Dr. Paul here. We're about to see a rash in a young man who's been on amoxicillin for what was thought to be strep throat. Let's go take a look. There we are. So that's Noah doing the filming.
My dad has the exact same.
He does?
Phone.
Oh my goodness, those are good phones, aren't they?
Yeah, they're big.
They're big. They take really good pictures, right?
Yeah,
They do take good pictures.
Good pictures.
Oh, my goodness, you have a rash. What happened?
Well, I got it last night.
It started last night?
Yeah.
Me
and Chloe are just playing because we do it all the time.
Okay.
And I didn't even know I had those rashes.
You didn't even know. Where did it start?
I don't know.
Did it start on your hands or your legs or your...
This started on my tummy.
You think on your tummy? Is that what you saw? Yeah? Okay.
Mm-hmm.
All right. So first you had some little red dots maybe? Yeah. And then it got all over, didn't it? Let's see your hands. Let's see your hands. Oh, it's even on your hands. See that? Yeah. Now let me look at your hands. I'm going to just try something for fun. We're going to push on that rash. And oh, it disappears. See that?
Yeah.
Push on it, disappears, comes back. Push on it.
That's what the other doctor did.
Did the other doctor do that?
Pushed it on
like
my
that?
finger.
Yeah, because we can take a spot here and it totally goes away. See that? And then boop, it comes back. You can do it too. That's a good thing. So when you have a rash that you can push like that and it goes away, then we know that it's not like a serious infection where you've got broken blood vessels. I've done a video before that showed petechiae, and those would be the little broken blood vessels that when you push, they don't go away. Those are more serious. So this rash, now let's get a little more of the story here. Can you fill us in maybe on the story?
Sure. Well,
Okay.
he was on amoxicillin for an infection.
Yeah.
And the rash just showed up yesterday evening. I was really surprised, and I thought it was chickenpox at first because they were just dots on his torso.
Yeah.
And I put him to bed and thought, well, maybe we're going to be in quarantine for the week. And then I woke up and he had quite a few more, and then they started to kind of blend together. And the way his face looked, he started to look puffy, and his ear was so red and definitely puffy. Didn't look like himself, and I started to feel that maybe it wasn't that, but I wanted to be sure.
Sure. Is he complaining of it hurting or itching, or you're not noticing him scratching?
No, at first he did, but I really
scratching
think it was
a little
power
bit.
of suggestion at
Maybe.
first.
Okay, I mentioned it. He starts
I
scratching.
have a big brother that's always angry at me.
Yes.
He is?
He's 12 years old.
Oh my goodness.
That'll be a video for another time. Hormonal siblings.
Okay.
If I go to the doctor ever again.
So I understand also that he was exposed to strep. So for the viewers, we swabbed his throat a week ago, and it was actually rapid strep negative. But because of his prior recent exposure to strep and just the foul odor, the provider decided this just looked so classic strep, and with a recent exposure, to go ahead and treat him and sent off the backup culture. Incidentally, by the way, the backup culture came back negative. So what do? Well, our nurses called, and come to find out, in about a day and a half, he was completely better. Is that right?
He was remarkably better.
Remarkably better.
Yes.
And continued to do well. So that tells you probably it was strep. We had a prior exposure and he got better on antibiotics. But for our other providers and viewers, you all know if you're a provider, we are not supposed to treat a potential sore throat if we can't prove that it's strep. At least that's the standard of care at this time. But as a clinician, you make exceptions when it's just so clear there's been an exposure, the throat looks horrible, and sometimes there are strep infections that are not group A. Our rapid strep just detects group A, or there may be other bacterial causes of pharyngitis. Now, one of the things when I walked in today and I saw this rash, my immediate thought was, he had a sore throat, we didn't prove it was strep, he was given amoxicillin, and now we have this rash, which is pretty impressive, slightly raised. Thankfully, they do blanch, so this is good that they're blanching. It's nothing serious. And the rash that we worry about sometimes is not dangerous, it's just important to know about. And we do have another video about this, is the rash that you get from mono, a person with mononucleosis, which is Epstein-Barr virus infection, who then gets amoxicillin. You can get, bam, this big rash like this.
Can I take a bath today?
Yeah, I would make sure your bath has, it's not too hot. Because if you have a hot...
Get it hot.
Yeah, but
Really
don't get it too hot, because then your rash will get even worse.
We don't get it way too hot.
No, not too hot, just like a little bit warm. So you can almost get the idea that some of these lesions, like this one on my fingertip here, has a slight bit of clearing in the middle and it's redder on the outside. That's what we think of as a target lesion, very classic for an allergic reaction. Now oftentimes an allergic reaction is, let me see your hands again, is very itchy. Now having these lesions on his palm, you can get this with an allergic reaction. The only other thing you get with that'll give you little lesions on your palm is Coxsackie virus, hand, foot, and mouth. So just to be sure we're not missing Coxsackie virus, hand, foot, and mouth, we're going to take a look in your mouth. Would that be okay? Okay. Let me get my flashlight. All right. We've already looked, so I know what we're going to find, but let's take a... Oh, good job. So we have here a very nice looking tongue, and the throat is almost perfect. Can you say, ah? Good job. Oh my goodness, that's a great, great job. Yep, there's no lesions in his mouth.
One time when I would open it and I still had that bad thing in my mouth, it would be like dots, white dots in my mouth.
Very good. So the main thing when you have an allergic reaction is stop the medicine, and thankfully you did that. So perfect. He's had a week's treatment. That should be plenty for the strep. And we want to listen very carefully.
I just watched my favorite movie.
Did you?
Yeah, part of it.
Okay.
Big Hero 6. It's my favorite movie ever.
What was your favorite movie?
Big Hero 6.
Oh, okay. So take a big breath. Good job again. Good job again. And one more time. Absolutely no wheezing. So when you have a bad allergic reaction, this is just a rash. But if it got a lot worse...
I was just trying to be dead. So you would have known.
You did a good job. If it was way worse, you might have trouble swallowing or trouble breathing, which, by the way, that's why you would come back. Trouble breathing, trouble swallowing, you get right back here. Otherwise, you can treat this with any of the usual over-the-counter allergy medicines. I think he's already on one. On Zyrtec. You can do Claritin in the morning, Zyrtec at night. Generic versions are fine. A little Benadryl at night makes most people sleepy.
Mom, you have to go get me an
That would be okay.
a Frosty at Wendy's.
We'll get you a treat.
You're going to get a Frosty? I think you should get a big one. You did such a good job.
I'll take most.
So thank you for letting us see your rash.
Why?
And I know you're...
No, they don't have big ones there.
They don't.
They do. You could say you're welcome.
You
Thank
told
you.
me to say it.
You did good. You did so
a good job,
So,
sweetie.
congratulations. You're going to be a YouTube star. You can put your shirt on if you want. You want to put your shirt back on? No? Okay. No, you can let him be. If he's not distressed, I would let him be. If he's having trouble breathing or coughing, obviously we need to make sure he's not progressing into more of an allergic response. I would not give Tylenol, acetaminophen. Just I would if you needed anything for pain or discomfort, other than the allergy medicines, you could use ibuprofen. So, folks, there you have a pretty impressive rash that could have been almost anything, right? So it's a process, what we call differential diagnosis, of sorting out what's the most likely thing here. He's already on an antibiotic, penicillin, both penicillin and sulfa. If you're on those, that is your most likely cause of an allergic reaction. So you've got to rule that out first, and if they're on it, you must stop it immediately and treat for symptoms of allergy. In this case, it was pretty clear. He had strep, well, presumed strep. He got better on amoxicillin, so that helped confirm it, and he had a prior exposure. And now we've got a fairly classic allergic reaction to penicillin, and we're going to stop it, and he's going to be fine. Thanks for watching. I'm Dr. Paul.
Bye.
Bye.
Bye. I blew up myself.
You blew yourself up, Mom.